Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the Department of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. Today I welcome a colleague, Erica Alessandrini. Welcome to the program.
Hello, thanks for having me.
Now you are a certified registered nurse practitioner, but more specifically a family nurse practitioner.
That's right.
And you have joined the faculty at SU, Department of Nursing, but you have a variety of experience working in offices and such in cardiology, college health, and in plastics and dermatology.
Absolutely.
And we were trying to come up with a topic that we thought would be riveting, and we decided to do shingles because there's a lot of new information about shingles and this new vaccine that you can get.
Absolutely.
So let's take on the topic of shingles.
Okay.
And first of all, describe it. What is it and what causes it?
Well, shingles usually occurs as we get older, as our immune response kind of wanes after having chickenpox as children or younger adults. And it presents as a unilateral, meaning one-sided rash that's very painful, it's uncomfortable, and it's worrisome. Usually it occurs on the torso, chest, or back.
But we can see some cases on the face.
You can.
But
yes.
the majority are on.
The majority is on the torso. Yes.
Now, is it the same virus?
It's the same virus as the chickenpox virus, the varicella virus it's called. Yes.
And don't they also call it herpes zoster?
Yes, it's also called herpes zoster. But what happens is when you're a child or a young adult and you're exposed to the chickenpox virus, you develop chickenpox, and then it recedes. After you get over the illness, the virus actually recedes into the nerve endings. And then over time, as we get older, usually after age 50, whatever reason, our immune system starts to weaken.
Yeah.
And then if your immune system's down, you're sick, you're stressed, something happens, and all of a sudden you have a reactivation. Your body's not able to keep that virus under control anymore, and you have a reactivation of this virus. But it usually won't be widespread like the chickenpox rash. It actually just affects one side of the torso typically. It's usually a band-like distribution.
And it is different than the virus, the herpes virus that causes fever blisters and genital herpes.
It
and
is.
Those kind of things.
It is separate from that. It's the chickenpox varicella virus.
Now, what's the prevalence rate of shingles in this country?
About 32% of all Americans will develop shingles at some time in their lifetime.
That's more than I thought.
Yeah.
Now, you're saying the major risk factor is just getting older, age,
yes.
partly because your immune system weakens, so the virus is dormant
Absolutely.
and then resurfaces.
Absolutely. So as we get older, the antibodies that we've developed from having chickenpox over time recede, and then as we get older, your body's just not able to keep it under control as long as they used to, and so you'll have an outbreak of it.
Now, is it contagious? Like, can you get it from touching someone and then you get it?
Yes and no. Shingles itself isn't contagious, but for somebody who has never had chickenpox, if they're exposed to somebody with the shingles rash, they can contract the varicella virus and have an outbreak of chickenpox. So you can't get shingles from someone with shingles, but if you've never been exposed to the chickenpox virus in the past, you can develop chickenpox.
And what about pregnant women? Is it a problem?
Typically not, because they usually have had chickenpox as children themselves, or they've been immunized. If they do develop a shingles-like rash during pregnancy, typically they will start antivirals with pregnancy as well.
Now, I know babies can be susceptible
Yes.
if they've not been immunized against chickenpox till they're about a year old.
Correct.
So that can be a problem, say, with a grandparent or whatnot.
Absolutely. So yes, if you have the shingles rash and you have young people that you're around, infants that you take care of, you should definitely avoid them until the rash heals over because they could develop chickenpox.
Now, what are the symptoms? I guess we'll show some pictures,
Sure.
too. A picture's worth 1,000 words in this
Absolutely.
case. But would someone feel signs before the rash appears?
Very often. A lot of people complain of feeling some numbness, a prickly sensation, even some burning at the location a day or two before the rash actually starts. And they'll say, oh my gosh, that hurts. I don't know what that is. And then 1 or 2 days later, they will develop little tiny blisters, a big patch of little tiny blisters. And then 2 to 3 days later, those little blisters will actually ulcerate. They'll become little shallow open sores. And then about day 7 to 10, those will actually crust over and develop scabs. And at that point, you're considered not contagious anymore. You're not shedding the virus. And then it takes about 2 to 3 weeks to typically for the rash to disappear altogether.
Now, I know what I always hear about shingles. I've never had it. I've had fever blisters, so I know what that tingling feels like, but that shingles is very painful.
It can be, and that usually gets worse as we get older. If someone develops shingles after the age of 60, 70, 80, they're at risk for more serious complications, especially something called post-herpetic neuralgia. And what that means is very severe burning pain even after the rash disappears. And it can last for weeks to months to, in rare cases, even years.
Now, I know you said it doesn't occur on the face as commonly at all, but if it is on the face, it can be dangerous in terms of vision issues?
Absolutely. If you do notice that you have any pain, tingling in the facial area near your nose, your ears, your eyes, that commonly can indicate that it's affecting the trigeminal nerve that's there. And it can be very dangerous to your vision, and it can actually cause loss of vision if it's not treated immediately.
So specialized
yes,
care
absolutely.
there, yeah.
See your provider immediately, and they'll usually send you to an eye doctor immediately.
Now, just to clarify, is it just in one place? It's either on the face or the torso?
Typically, yes. And typically you'll see it on the torso, usually the back or the side, sometimes the chest, but it's only one-sided. It's not over the whole.
What's the reason for that? That's interesting.
Because there's something called dermatomes actually in the body, and I'll show you a picture of that. But it's just the way the nerve endings are in our body, the way it runs. When the virus is reactivated, it usually runs right along those nerve endings.
Okay, so we talked about the symptoms and what the rash, looks like, and the pain. Does it itch at all?
It can be itchy, but typically it's more of a burning or painful, but it can be mildly itchy.
And it's severely painful, correct?
It can be. Not everybody. I mean, there's some people that have it and it's just a mild burning, but it can be severely painful, and that's the ones that we're obviously very worried about.
Well, let's talk about treatment.
Sure.
Because I know you said people need to get into the doctor fairly
Absolutely.
quickly, or that's optimal.
Absolutely.
And we know sometimes people don't go to the doctors when they should, but you're saying that usually the pain, and people get quite concerned.
Absolutely. So the best thing you can do is early treatment is the best thing you can do. They typically recommend that if you can get into your primary care provider within 3 days of the rash occurring, that's the best thing you can do, because they can start you on antiviral medication. And what that will do is actually help keep the virus from replicating or from growing. So you'll have a less severe rash, it won't last as long, and your risk of developing those complications we talked about is really dramatically reduced. So really try to see your primary care provider as soon as possible.
And when you say antivirals, you mean things like acyclovir or Valtrex, things that they use for fever blisters as well? Because it's all similar, same family.
It's very similar, yeah. It just helps keep that virus from growing and multiplying out of control.
And these are meds you just take by mouth?
Yes, yes.
Now, what about the pain portion of it? We can manage the pain with medicines as well?
Usually, yes. For the very mild cases, it can be usually managed with over-the-counter medications like acetaminophen or Tylenol. Also, ibuprofen or Motrin is the brand name for that. But in the more severe cases, sometimes you'll need to have prescription pain medicines to manage the pain.
So something more on the lines of narcotics.
Exactly.
And what kind, like the codeine preparations more so?
Even the severe ones. People have really severe pain, have trouble sleeping, and a lot of times they'll even require things like oxycodone and things like that.
Now you're saying it usually will be gone in about 2 to 3 weeks?
2 to 3 weeks, usually the rash will completely resolve. But again, you have that rare, about 10% of people with shingles will develop that post-herpetic neuralgia, which can be extremely devastating.
Now you say there's blisters there typically. Mm-hmm. Are they a wet blister where you wear a dressing, or are they more of a dry?
They're more of a dry blister until they break, and they're the shallow ulcerations. They usually don't weep too much, but you do want to try to keep them clean, covered with a dry dressing, especially if you're going to be out and about, to help reduce transmission and to help keep it clean. You don't want to keep it wet at all. The best thing you can do is keep them clean and dry. No ointments, but a nice, clean, dry gauze dressing is fine.
And take your antivirals and your pain meds. Very good.
Exactly.
Now, The great thing about shingles now is that we have a vaccine. And there's been a lot of discussion about it, and I know it's an expensive vaccine, and insurance pays for it, but usually once you turn 60, is that the new recommendation?
Yes. The vaccine that has come out for shingles or herpes zoster can be given to adults over the age of 50. However, because of the risks associated with the severity and the complications that can come out with it, affects older people, more likely to affect as
So
we
not
age.
a problem with the vaccine itself.
Exactly.
It's the fact that the CDC says
The CDC
60 and older.
Exactly, 60 and older. And so for that reason, insurance typically won't cover it until you're 60 or older. But if you are concerned, if there's a special situation, you can ask your provider to order it for you over the age of 50.
So are there any other risk factors other than age or?
Typically not. It's just age. As we get older, the immune response that we had built up just gradually declines over time. Now, it does tend to happen if your immune system is weakened. That's when it tends to show up. If you've been very ill, if you've been in a car accident, if there's something like that that's happened, that's usually when you'll see the shingles outbreak appear.
So there's no genetic component, is there?
No.
So why would someone in their 50s maybe say, unless they're just really concerned or feel like they're in a weakened state, or, would want to get the vaccine early just to make sure?
If you're really concerned about getting it, or if you just had a personal experience with someone that's had a very bad case of shingles, you just might feel better having it at a younger age, at 50 or above, you can ask your provider for that. Also, if you're going to be the primary caregiver for an infant who's not going to have any protection from chickenpox, you are very much at risk for transmitting the virus to them. You might want to get it earlier.
And I know we checked out some prices because a lot of local area pharmacies do provide it.
Yes.
And I know I've always heard it cost about $300, but we did call around. We found a few places that were in the low 200 range.
Right.
I mean, that's a lot of money, but for peace of mind for someone that's really concerned.
Exactly. And you can just go to your local pharmacy and they should be able to provide it right there for you. And
of course, a lot of physicians' offices or primary care provider offices offer it as well.
Exactly.
And you're saying Medicare does cover it?
Yes.
Under, is it the Part D?
Part D. It typically covers it after age 60.
So it's just a one shot?
It's one shot. It's you don't need a bunch of boosters or anything like that. It's one shot. You should get the vaccine after the age of 60, even if you've already had shingles in the past.
Because you can get it again.
You can get it again. It's not very common, but you can get recurrent outbreak, and they do recommend that everyone over the age of 60 get one dose of the herpes zoster vaccine.
Now, there are cases where someone may still get shingles after getting the vaccine,
Absolutely.
but it's a much reduced type severity of case then?
Yes. So the finding, the studies show that people who get the vaccine aren't as likely to develop a shingles outbreak at all. Those who do usually have a much less severe rash. It doesn't last as long, it's not a big rash, and they don't have the risk as much of complications as those who don't get the vaccine. They don't have as much problems with the post-herpetic neuralgia, that long-lasting pain, or those types of problems.
To me, that would be worth it because I know it can be very painful, that neuralgia that follows it. So.
And it can last for months.
Well, thank you so much for all this information. It sounds like people can take their health into their hands if they're really concerned, and they'd have to pay out of pocket, but they can get the shingles vaccine.
Absolutely.
From 50 on up.
Absolutely.
And then, of course, I know many people do wait till they're 60 because it can be covered by insurance.
Absolutely. And just remember, you can get it under age 50. It's just you're probably not going to have as many complications as somebody who's 50 or older.
But
so
shingles
in general. So you can be in your 30s or 40s and have an outbreak. And so don't avoid going to your primary care provider because you're not over the age of 50. The best thing anyone can do if they are suspicious of a painful rash is to get to your provider right away, so we can hopefully help make it as easy as possible for you.
Well, just to reiterate, you mentioned they should really see their doctor within 2 to 3 days
Yes.
to get the best effects of the antiviral medications
Absolutely.
and such. But it's not good news, but the fact that it's painful, people will most likely go see their physician.
Typically, yes.
because I know we all tend to ignore rashes and spots and things.
Exactly.
But with something like this, it is important to get in to see your primary care provider.
Absolutely.
Well, thanks again, Erica, for the information on this important topic, and we'll post some websites at the end of the program where our viewers can get more information.
Great. Thanks so much for having me.
And thank you for joining us for this edition of Focus on Health here on PAC 14.
Focus on Health is sponsored by Peninsula Regional Medical Center, a proud supporter of PAC 14 programming.
Hi, I'm Peggy Nalepa, President and CEO of Peninsula Regional Medical Center. PRMC is privileged to partner with PAC 14 to provide educational healthcare programming for the Delmarva region. Peninsula Regional Medical Center, a proud supporter of PAC 14 and public access television.